All right, so today we are going to be finishing up the wrist and hand. Next week, you have your second exam, which is going to be over the upper extremity. So we will be reviewing for that next Friday. Then the exam will open up, just like last time. It will open up Friday after class, and then I'll keep that open until Monday night. So you'll have a little bit of Friday, Saturday, Sunday, and all day Monday to complete that. All right, I wanted to quickly kind of introduce this to you here. So this is the term paper you're going to have to write for the lecture portion of this class. So you should have already completed your biotech paper in lab. And what this one is now doing is asking you to do more of a specific analysis on an activity or a sport, something like that, where you want to do a full kinematic analysis of that particular activity. You're going to do a little bit more research with it as well. And you pretty much want to pick something that's going to be at least somewhat complex, but not necessarily something that has like 30 steps to it. Because in the actual analysis part of this, what you're going to be doing is analyzing all your kinematic motions, but you want to do it from each phase of your activity. So for example, if you were doing like say the overhead spike of a volleyball player, you would have your essentially your early cocking or wind up phase. You would have your acceleration or striking phase. You would have your whatever follow through phase, things like that. So you have all those different phases, and you're going to do essentially an analysis on each one of those. What I'm suggesting you do is you take either say like a video or a series of still images and use that as the actual activity you're analyzing. That way you have essentially a visual for each section, each segment of that actual activity. And then you're going to do the whole joint by joint, muscle by muscle kind of thing interaction there. Now, I want you to focus on whatever the primary function of the activity is. So again, for like say the volleyball spike, what body parts am I most concerned about with a volleyball spike? Yeah, your shoulder and probably your trunk as well. Now, to be able to do a spike, I have to jump in the air, so my legs are going to be involved. However, would you really consider the legs like one of the primary body parts for that motion? So would you view the legs as, yeah, probably not. So again, if you were doing this for your paper, what I want you to write is in say the initial phase, everything the legs do when you're actually jumping. Once you're jumping, you can ignore the legs for the rest of the entire analysis kind of thing. I want you to focus primarily on what the actual event is or the movement that's happening. I'm not so worried about the tangential stuff you have. What you can also do with this is essentially make a chart of this is your phase, this is a body part, here's the movement, axis, plane, all that good stuff. You can do that if you want for each segment, and essentially just accompany that with a small explanation as to why each is how it is, kind of thing. So you have a bunch of different options for that. Yeah, and again, this is really just like the first kind of introduction to this. This isn't going to be something that's going to be due for another month down the road. But what kind of questions do you have about this so far? So Ashley, yeah, you want to at least acknowledge the entire body. But once you do that initial, okay, my legs are going to help me jump kind of thing, but they're not really involved, then I want you to just focus on that main body part. So your topic should be a total body movement. I would, like I said, I would encourage you to maybe not do something that has 1,000 different steps to it, because for each step you have to do your analysis of what's going on there. You also don't want to do something that's like, say, a very easy or basic kind of movement, like a single joint exercise kind of thing, like biceps curls, triceps push down, whatever. That's really not something that's going to be appropriate because it's only a single joint movement. So something where you're going to have to do total body, at least in the aggregate. Now, for the literature review itself, what you're going to do is look up literature that is going to essentially kind of guide you through what is mechanically sound. So from the literature, you want to be able to discuss, what, say, muscle group or groups are primarily responsible, what, say, maybe like force production can some of the bigger muscles provide, any other like mechanical based critiques that are peer reviewed. So anything like that. Essentially, just try to find anything that's going to tell you what you should do in this particular movement. And then Melody, as far as training recommendations, that would be something that I would put in the discussion. So for the discussion, that's where you could put in, like, say, any kind of training recommendations. All right, any other questions on this? All right, all of your grades are updated through now, and I completed your midterm grade submission today, so you should be able to see that in your student portal. And again, just so you're aware, we're only 330 points in, so this class is definitely back heavy, so kind of keep that in mind. Although for the most part, everyone's doing pretty well here. All right, so I want to finish up with the wrist and hand today. So quick review here. With my wrist itself, what joint is what you think of with your wrist?
Did you ask what movement or what joint?
What joint? So yeah, Matt, you got that right there, the radiocarpal joint. Now, Eva, radial ulnar joint, that's going to make up your forearm. So you're definitely in the right area, just a little bit too proximal there. All right, and then what are the 4 movements I have with the radiocarpal joint?
Flexion, extension, and then ulnar and radial deviation.
Yes. So remember, you do not have any rotational movements with the, I'm sorry, not rotational. You don't have any abduction movements with the wrist. You have radial and ulnar deviation. So again, radial, thumb side, ulnar, pinky side. All right, and then let's see here. What type of a joint is that? So it's not a hinge. A hinge would only give me essentially sagittal plane movement. Yeah, so Alyssa, wrist joint or your radiocarpal joint, that is going to be an ellipsoid joint. Ellipsoid is because we have 2 degrees of freedom here, so we have that, and we can make essentially a circular motion with it. All right, and then as far as muscles for the wrist and hand go, what are the 3 keywords I want to look at for identifying really any muscle I have in the wrist or hand? All right, so how about carpi, digit, and pollicis? What's carpi mean?
Wrist.
Yeah, wrist or your carpal bones. Digit? Yeah, your fingers. And then pollicis?
Thumb.
Yeah, it's your thumb. And then for the most part, flexion extension, radialis, ulnaris tells you virtually everything. All right, what kind of joints are my MCP joints? Oh, yes, condyloid. Sorry, I didn't see an answer there. Jessica's, thank you. Yes, they are condyloid. They are going to allow for abduction and flexion extension. Now, what about my dip and pip joints?
So those would be hinge.
Yes, those are hinge. So those are only going to give us my flexion extension. All right. And then to kind of go back over our muscles, remember any extensor is going to bring the wrist back. Carpi or radial That's going to tell you if you go thumb side or pinky side. Let's see here. What muscles are going to allow me to flex my dip and pip joints? Flexor digitorum, that's correct. And which one? Profundus, and what's that going to do? Yes, that's going to move your dip joint. And then what's going to move pip? Superficialis, there you go. Yes, so your flexor carpi superficialis is going to be on top. It's shorter. It ends up at the pip joint. So flexes pip, and flexor digitorum profundus, deep, going to end at the dip joint. Okay, remember that your wrist flexors and extensors are going to share a frontal plane movement, depending on which one they are. All right, so that's really everything with the anatomy there. How are you all feeling about the anatomy side of things? Hopefully halfway decent. Oh, last thing real quick with the thumb. Remember, our thumb movements are different than everything else. So with our thumb, you have abduction, which is going away from your palm of your hand. Adduction is just putting your thumb back to where it started. Flexion, you're coming across here. Don't confuse flexion with opposition. Opposition is where you're touching a thumb to a finger. Flexion is where you just bring your thumb across your hand. Reposition and adduction are the same thing. So if you said reposition or you said adduction for your thumb in this position here, either one would be correct. But flexion across, extension out. So extension, you're making that nice L. Abduction, you point away from you. All right, getting into our grips here. Two classes of grips. So your power and precision. Power grips are all going to really be about doing gross motor skills. Precision grips are going to be much more fine motor skills. A couple of generalities. So your hook grip is the only one that doesn't use your thumb. Your spherical grip and your cylindrical grip are essentially interchangeable. I mean, you can really hold most things, generally speaking, in a variation of that. But the main difference between those two and your fist grip is the thumb involvement. So in a cylindrical or a spherical grip, you aren't touching your thumb to the rest of your fingers. With a fist grip, your thumb is enclosing the fingers. So you're actually making a fist. Now, other than using, like, say, a actual like hanger or whatever, where else do you think you would use a hook grip?
Olympic lifts, Olympic weightlifting.
Like which one?
I mean, you could use it for a snatch or a clean.
All right, for a clean, I can get there on the catch. So when you're actually catching, okay, I can see that. Really difficult though to say that you can use the hook grip for really any of the pulling parts of it. You especially can't do it for the snatch because you have to have that thumb involvement to actually make that work. So the clean, definitely on the catch. On the actual movement itself, though, a little bit difficult. Does that kind of make sense?
Yeah, I don't use it like because I do Olympic lifting. I don't use. I just feel like my thumb's gonna like break if I use it. But for the most part, a lot of coaches that I've seen, they teach like the hook grip for pretty much any lift. Pressing, you can't really use that. But yeah,
That's interesting. And I'm going to come back to that particular point, though. All right, so play with me here. Imagine this is a nice huge box or whatever. And I'm trying to lift this off my desk here. If I get under this, now again, imagine this is like, much, much bigger. Am I going to be able to get my thumb around the entire side of the box? And again, imagine this is taller. So no, I'm not. So whenever I'm lifting anything, especially, packages, whatnot, primarily you have to use a hook grip. There's no way for your thumb to get involved with it. So that's where you'll see hook grip happen. And side note, as long as if you are, say, lifting anything, especially off the ground, remember to keep your back health in mind. So you don't want to increase your moment arm, causing more resistance to have to go your way. All right. With the hook grip here for exercising. Now, regardless of how someone gets taught with any particular lift, one of the things you can use a hook grip for is changing where you are going to have essentially more muscle recruitment from your forearm. So we've talked before about how, let's say, if you were doing an exercise such as like a triceps push down, that you can train your abs while doing that because you tighten them, you make them act as stabilizing muscles, they're going to work harder. Now, if you are doing your tricep push down all bent over and whatnot, no, you're not going to get much of anything out of the core because it's not stabilizing you. You're really taking that out by going into trunk flexion. If I'm upright, doing the whole tummy tuck kind of thing, great. Now, abs are working. Same thing is kind of true with using anything, especially like, say, machine-based exercises are pretty easy to do this. But whenever I'm using my wrist or forearm, you have to consider how much of the forearm your thumb is controlling, essentially. So even if you just grab your forearm, you move your thumb around, you'll feel all around where you're getting stuff going. And your thumb plays a really big role with your grip strength, essentially what's going to seal everything in. Well, most everyone, when you're gripping, say, a a bar or whatnot, you're kind of holding it like this for the most part. So I would argue this is really a fist grip. But if you take your thumb and put it, well, this thumb is both, and you put it around the bar so that it goes into a hook grip, what are you doing? And I should say, like, physiologically speaking, what's going to happen?
You'd have to use more of your forearm muscles to stabilize your wrist.
Yeah, exactly. It's a very good way to put it, too. So just like I can get an ab workout indirectly from making the abs act as stabilizers, I can do the same thing with forearms if I remove my thumb from the equation. So instead of having that normal kind of fist grip, if I put my thumb outside of the bar where my fingers and thumb are all on the same side, it's going to force more forearm muscles to be working, especially acting as stabilizing muscles. So you're going to get a lot more immediate response out of those than having to essentially, do, any of your forearm based exercises, your wrist curls, your reverse curls, the radial ulnar deviations and pronation, supination ones. So you don't have to really do all that if you can target those muscles at least tangentially. That kind of makes sense? All right. Precision grips are much more specific than your power grips. So like I was saying earlier, arguably you can interchange really your fist grip, your cylindrical grip, and your spherical grip. For the most part, those three are pretty much just variations of each other. Hook grip, yeah, a little bit different because you're not using the thumb, but you get the idea there. Precision grips, you really can't do that because you're not going to get the same function out of each of these variants the same way or in a similar manner as you would out of the different power grips. Meaning, with your, say, lateral pinch and tip to tip. So, lateral pinch, you're pinching the side of, say, your finger, tip to tip, you're touching tip of the thumb to tip of the index finger. Well, some things I can say act will be like interchangeable. So I take, say, chapstick. I can do a lateral pinch on it, or I can do tip to tip. So I mean, I can do those same things. But let's say here, yeah, I don't have any coins or anything. Of course not. So let's say that this set of keys here is coins. Now, if I go to pick up a coin, what grip would I be using? Yeah, probably a tip to tip. Very hard to say pick up a coin with any kind of like a lateral pinch because you need to have some way to essentially turn it on its side. You can't really turn it on its side unless you use that tip to tip kind of grip there. So yeah, lateral pinch, really, really difficult to do that. And you see that that's just a variant from there to there. I mean, that's it. And you're essentially eliminating almost half of the precision movements you can do. Now, what you do, though, is you combine them into the three-prong chuck. That is what actually will kind of be the best of both worlds in terms of your precision grips. So with your precision grips, these are all fine motor skills. So with a three-prong chuck, you kind of do the same, like kind of a hybrid almost of lateral pinch and tip to tip, but you're using your middle finger as essentially a, not really a balance point, but I guess a support point here. So if I didn't have my middle finger here to hold the bottom, and like, let's say, you know, even I'm using a pen or something. I don't know where I got this, but I'm kind of pumped that I did, that GCU makes these pretty awesome pens. Anyway, if I'm holding this with essentially a lateral pinch here, but using my middle finger to complete this three-prong chuck, what happens if I take my middle finger away? Yes, it falls much more easily. I have very little control over this. I mean, yeah, I can hold it, but like as I squeeze it, I can already feel it kind of slipping out. And that's again because that lateral-ish pinch I have going on here is not the best for holding these cylindrical, you know, items. Using the middle finger underneath, I have the most amount of really precision and control with that. So gross motor skills, power grips, fine motor skills, precision grips. The other thing with these grip types is remember how our muscles or our motor neurons are going to innervate this. How many muscle fibers per nerve cell-ish do you think you're getting for a power grip? And then how many for a precision grip?
Would it be more for power than precision?
Yes, why?
The more motor units I guess, you're using, the more strength output, and then the opposite.
Kind of. So yes, the more muscle fibers you have, the more muscle fiber activation you're going to have. So yes, you will be able to theoretically produce more force. As Matt said it in the chat there, when you have less muscle fibers per nerve cell, you have much more control over those fibers. So you have a much easier time with doing these very precise movements. The more fibers you have, the more strength you have, less control you have. It's kind of like, do you think you all could lift, let's say, I don't know, even like say 30, 35 pounds with your three fingers here? So just using these to kind of squeeze a weight, you can lift 30 pounds kind of that way. I'm going to go on a limb and say probably not a whole lot of people can do that. Conversely, how many of you can write with your elbow? So how many of you think you can do this and actually be able to write? I should probably say legibly. Yeah, probably not. So again, more muscle fibers, more strength, less control. Less muscle fibers, less strength, more control. So precision grips are going to have less muscle fibers per motor unit, but you're also going to be able to have very fine, precise movements with that. Ooh, this is not aged well. Yeah, probably want to skip that one. Gone forever, Dan Marley. Okay, so everyone knows about your arches in your feet, or at least I'm assuming that. You also have the same or similar arches in your hand. However, they're really not that important in your hand. And why do you think that is? So why are the arches in your hand really not important? Yeah, I wouldn't even say you're not as much. You aren't at all. Your hands are non-weight bearing. If something is non-weight bearing, then you need very little structural support to it. It's kind of like with your fibula. Your fibula is non-weight bearing. So it has very little structural support to it. It really doesn't even like connect to the rest of your leg or ankle. You have, ligaments that kind of wrap around it kind of thing. But yeah, when you're non-weight bearing, your structural integrity doesn't matter. It's kind of like you got the Empire State Building and you got the Space Needle on the top, you got the foundation on the very bottom. Which one needs to be the strongest, most durable? Sorry, don't all yell out at once.
The foundation.
Yeah, absolutely. So your feet are your foundation. So the arches in your feet definitely play a role in a whole lot of mechanical and health issues. Arches in your hand, not so much. Now, they do help to give it shape. So you wouldn't be able to essentially bowl your hand kind of thing without that. I mean, all right, if you're a basketball player, palming a ball is probably important. For the rest of us, I feel like I can go without it. So yeah, arches of your hand, analogous to the arches of your feet, but they don't actually do anything. Now, however, if you were someone who walked on your hands all day, that now would make that an interesting predicament. Okay. With our wrist comes our carpal tunnel. And your carpal tunnel is really just, straight middle of your wrist. So if you take your middle finger and your thumb, you should be able to approximately put it around your wrist. So that is about how big your wrist is, or your wrist circumference is. Now, your carpal tunnel, and that is this here. So that's how big this is. This is your carpal tunnel. That has to fit in this. Just at a quick glance, you can see 1, 2, 3, 4, 5, 6, 7, 8, 9 tendons that run through there, plus this guy, which, as you can see here, is our median nerve. Kind of important. You will need to remember that number 9. But again, wrist, carpal tunnel, fit 10 of anything in that hole. That sounds really terrible when I say it out loud, but you get the idea. Very, very small opening with a bunch of stuff going in there. It's kind of a wonder why not everyone in the world is walking around with carpal tunnel syndrome. But when you have carpal tunnel syndrome, you have inflammation in there. How easy do you think it is to get that inflamed? I mean, we looked at the subacromial space and how small that is. I mean, this makes that look like, you know, it's a mansion in comparison. So the problem isn't necessarily the overall size, it's just how cramped everything else is in there. Now, this here, this transverse carpal ligament, this is what holds it all in place. So you have that holding this down, kind of like that. But you see how carpal tunnel syndrome is going to be some sort of issue with the median nerve. Now, remember your nerves in your upper extremity. Start with your axillary nerve, comes down to your elbow, splits into 3. We have your radial nerve going down your thumb side. You have your median nerve bisecting the forearm, ulnar nerve going pinky side. Well, each of those control essentially a different part of your hand. So your radial nerve controls the outer half of the index finger and your thumb. Your median nerve controls your whole middle finger and the inside portions of your ring finger and your index finger. And then your ulnar nerve controls the pinky and the outside of your ring finger. When you have carpal tunnel syndrome, the tendons themselves don't matter. It's any pressure that's seen on the median nerve is what's going to primarily cause you symptoms. And wrist flexion activities will be uncomfortable. Why do you think that is? Yeah, absolutely. When you flex the wrist, you're going to compress that area even more. This is why if you ever do have carpal tunnel syndrome, you'd be wearing a wrist brace that puts you into extension. So you'd actually be in slight extension here to give more essentially opening or leeway to that. Now, where you're going to see this is primarily in overuse situations. There's really 2 professions that are going to, or 2, I guess, should say, professional areas where you're going to see carpal tunnel syndrome much more than others. Where do you think those are? So what jobs put you at the highest risk? Yeah, office or desk jobs, definitely. More typing you do, not a good thing. There's one other group. There we go. Yeah. Not necessarily limited to construction, but manual laborers. So you'll see like carpenters, electricians, plumbers, anyone that does essentially swings a hammer around, that's going to be potentially problematic. If you've ever played baseball or softball and you've gotten jammed swinging the bat, like hit the ball like at the, near your hands, and you get that nice, terrible pain in your hands, nice like stinger you would get. Well, that's all from vibrational, really frequency. So the vibration of a bat will carry that into your hands, hurt them. If it hurts, say, the ulnar nerve, the medial nerve, and then gets that inflamed, and now let's say again you got to swing a hammer all day, it's just like getting a stinger every single time you do that. It's very easy to fix this. You rest and you put your wrist into extension. If your job, however, requires you to, like again, say, swing a hammer around, how do you actually get this to heal then? So while this gets into a bigger discussion on, jobs and healthcare and whatnot, I hope you get at least the concept that some of these injuries, while benign in the grand scheme of things, can be terribly detrimental in your overall life if you count kind of the domino effect that happens. I don't think any one of us would ever say that, carpal tunnel syndrome is, right up there with like, say, heart disease and cancer. But I don't think any of us would want to have it if we, had the choice. But if you do get it and you have to keep doing what caused it as part of your job, see how potentially conflicting that can be. All right, different injury stuff. Don't really worry so much about this. Yeah, not so worried about all that. What I do want you to know is a couple of these major ones. So forearm fractures, yeah, I mean, that's simple. Boxer's fracture. So this is where you're going to have a fracture in the fourth and or fifth metacarpal bone. You get this through punching somebody. Not that I want to teach anyone how to fight, because I wouldn't ever want to. I kind of take the Ferdinand approach with everything. But if you're going to punch something, first off, don't ever put your thumb in there. I've actually seen people try to do this, and I felt just even awful for them before that even happens. That is a very quick route to breaking your thumb. And you don't really want to hit somebody with like the front of your hand. The much safer way yet effective way to do it is with a hammer fist. So you hit it down on a hammer fist. That's going to, gosh, I really hope that none of you actually take this advice and go and try to use it now. All right, a fouche or either a scaphoid or a trapezium injury here. These here are really most likely to happen if you're falling down. It's kind of it would be if you fall down with your wrist supinated, but then you fell into flexion. So you would essentially need to hit the ground kind of like this thing. And either side really of the wrist is most susceptible to that. You can also see this with, you'll see it occasionally in golfers who ground their clubs. So you can actually fracture your wrist by grounding your club, meaning when you swing, you hit the ground before you hit the ball. That can actually break your wrist doing that. And it's that whole same ball bat principle that you hit a club at a certain point, it can cause that vibrational force to carry through the club into you, and that can actually break your bones there. Skier's or gamekeeper's thumb. This is where you get a torn ligament in your thumb from getting it caught. All right, avulsion injuries. It's debatable if you would want, like, say, something like this or something like this. If you have a regular sprain or rupture, your tendon ligament straight up just tears. Pretty straightforward. You suture that back together, good to go. If you have an avulsion injury, typically your tendon or ligament, it's really only going to be a tendon, but your tendon is perfectly fine. However, it rips off a part of the bone from it. Essentially, what's happening here is the tensile strength of the tendon is greater than really the, for lack of a better word, density of your bone. So while the tendon stays intact, the bone rips itself off. It would kind of be like if we were playing tug of war with a piece of string. Any one of us that pulls on that string are going to rip the string, but are either of us going to move? And no, we wouldn't. So that's the same thing happening here. You're pulling on that tendon, not enough for it to break or rip, but enough to pull a piece of that bone off. Mallet finger or any kind of like trigger finger, typically you're getting hit straight on, like straight on the fingertip. This here is actually bursitis. So that's how big your olecranon bursa can get when they're inflamed. And that's going to be pretty solid there. So remember, your bursa sacs are these like kind of snot-like consistency. They act as padding, cushion. They give more lubrication to your joints. When they are inflamed, they actually harden up and they expand quite big with their size. This is going to cause actual movement to be compromised just because of the sheer amount of inflammation in there. If you look at a dislocation, yeah, you can tell something's off here, but how deformed is his arm or their arm? I mean, if you just showed just this picture to a layperson, do you think they'd say anything's wrong with the arm? Maybe probably not. So when you dislocate an elbow, this is going to be terrible pain. If any of you have ever done that, I hope you haven't. But the amount of deformity is barely there. I think we would all agree that this looks a lot worse than this does. Now, if you were describing this and this in terms of their kinematics, what kind of kinematics would this describe? So this should be a callback to hopefully what you learned in week 1, if you did maybe. Osteo and arthrokinematics. So which one is this?
Osteo.
Why?
Because it's just the bones out of place.
You can see it, right?
Right, yeah.
How about this one? Yeah, arthro. So this would be arthrokinematic because this is what's happening at the joint surface under the skin. You don't ski it. You don't ski it. You don't see it. All right, tennis elbow, just tendonitis of the forearm. Dislocations. Now, with dislocations, there's no real, like necessarily, like say a surgery or something to have. You don't really necessarily need, like say, casting. You're gonna need some sort of immobilization, but dislocation recovery time is highly variable based on the integrity you have of the underlying soft tissue. Ganglion cysts, you'll typically see these really on your posterior wrist. And this is what a whole one looks like. So these are kind of partially fluid filled, partially cell filled, or like dead skin cell typically filled. But what makes this a different brand of cyst is that it's deep. So you notice how deep down into the wrist there they are with this. You can't just go to Dr. Pimple Popper and have her take that out, because this is something you would need to actually have surgery for, like some sort of anesthetized surgery, because you're going deep into the wrist. Remember, with cysts, unless you get the entire sac out, it'll regrow. All right, and that is about everything there. All right, so I don't want to jump ahead here into the hip since we only got about 20 minutes. So we'll start that then next week. Now, what kind of questions do you all have right now on wrist, hand, really anything related to the upper extremity. All right then. Well, let you go a few minutes early. Hopefully that's okay with you all. But yeah, if you have any more questions, I will stick around until you all leave. If not, thank you all for getting through all this with me. And then I will see you back here on Friday.
Thank you.